7:26 in Trinidad and Tobago. Let's touch on a medical condition that we've talked about before that is exclusive to females. It's known as endometriosis. It's a condition in which tissue similar to that which lines the inside of the uterine wall grows outside of the uterus, such as the ovaries and the fallopian tubes. Endometriosis can affect women of any age, and during this month, the month of March, more is done to educate the population on what can be a very painful condition. The local chapter of the Endometriosis Association is hosting Endo. It's a virtual event on Saturday from 3 to 6 p.m. to help raise awareness. We'll be joined now by two personalities to give us some perspective on it. Dr. Janelle Jackman, Vice Chairperson of the Endometriosis Special Interest Group, and also with us is Karen Hinkson David, Public Relations Director of the Trinidad and Tobago Endometriosis Association. So in keeping with that portfolio, if I could ask the Public Relations Director, very good morning to you, Mrs. Hinkson David, just to give us first of all, the basic information of the event that's coming up on Saturday afternoon.
Okay, well, on Saturday we're hosting our local virtual Endomarch, which coincides with the worldwide Endomarch that's taking place across the world. As you mentioned earlier, it's from 3 to 6 p.m. It promises to be quite exciting because we have a very interesting lineup of activities. It proposes to be like more of a wellness session where we have a self-care talk, we have yoga, we have aerobics, we have even a dance party and Zumba. Persons who wish to participate, of course, can log on to our website and our Facebook page at Trinidad and Tobago Endometriosis Association for more information.
And the website is www.endott.org. Is that correct?
Correct.
Is there a deadline for registration?
Can you repeat that?
Is there a deadline for registration?
Oh, Friday would be our deadline for registration. And I can tell you now, Fazir, that the entry requirement is just to purchase a mask at 20 TT. So when they log on to the Facebook page or to the website, all the information will be there to guide them through.
All right. Let's go to Dr. Jackman. As far as being involved with the special interest group, what perspective can you lend to our discussion this morning, Dr. Jackman, when we're talking about the issue of endometriosis in Trinidad and Tobago? Good morning to you.
Good morning. So endometriosis, I mean, the main thing is raising awareness because 1 in 10 women are estimated to be affected with this condition, but I can tell you that the estimation is probably much higher than this. A lot of women remain undiagnosed or misdiagnosed. So we would like to create the awareness. As you said, it's tissue similar to the lining of the uterus, outside of the uterus, and it causes severe pain, particularly during your menstrual cycle, but it could cause pain at many different times. Pain when you're urinating, pain on bowel movement, back pain, sciatica-like pain. It can cause heavy menstrual cycles. So we just want people to know that this condition does exist, and anyone who may be experiencing similar symptoms should seek the help of their gynecologist, as well as maybe even seek someone specifically who deals with endometriosis to try and get help for this condition.
And our situation in Trinidad and Tobago, Dr. Jackman, where do we sit as far as the ease of diagnosis? Is it that people keep going to different doctors, getting different thing, or it's not that, it's something else, and after a while there's a level of frustration as to whether or not people are being properly diagnosed, and two, the levels of treatment that are available based on how severe the condition is?
So this is a worldwide problem that also exists in Trinidad, where the diagnosis is often missed. And the reason why is that you cannot really pick up endometriosis on any scan, on an ultrasound or a CT scan or MRI, which are the common scans that will be done when women present with pain. You're not going to pick up endometriosis unless it's concentrated in the ovary or in the uterus, and it's like a big volume. Smaller volumes, which is how it tends to occur, will not be picked up on a scan. So a patient comes in with pain, the doctor does an ultrasound, even your gynecologist may do an ultrasound, and they don't see anything. They may see a fibroid, so they may say, oh, this is just the fibroid, or they may see polycystic ovaries. So a lot of times women are told that it's the polycystic ovaries ovarian syndrome that is causing this condition, this pain, and it really isn't. It's usually endometriosis, and it's well hidden. So it is oftentimes
Mrs. Kingston David, yeah, you've just frozen up there for a little bit.
Usually after several.
Just say what you said again over the last 30 seconds, because your image just froze for a little while. Just repeat what you said.
Oh, I'm sorry. I'm saying that several patients will have this for several years, and those who are actually diagnosed, the diagnosis usually comes after 9 to 12 years of being treated for something also, or being told that they had nothing and it was all in their head. So oftentimes this is a misdiagnosed or undiagnosed condition, and that's why we're trying to raise awareness, not just to patients, but even to physicians, to be on the lookout for this diagnosis.
And Mrs. Kingston David, therefore, that's why this event is coming up on Saturday afternoon. What are you hoping it will achieve? Because we've spoken about this on occasion, not very frequently, I must admit, but have you seen any greater levels of awareness, greater willingness to consider endometriosis as a possible cause by physicians, that this might be something that they should be looking at? What are you hoping to achieve with this event on Saturday afternoon?
Well, on Saturday, let me first say that for the month of endometriosis awareness, the association has done quite a lot. We just completed a weekend of very successful webinars, a teen webinar, webinar open to patients, and our second nurses seminar. We also had, last Saturday was a special session of Spotlight Endometriosis, which catered to medical professionals. And our very dear Dr. Jackman, who's here with us today, was one of the presenters in that session. So this Saturday, we are actually closing off the month of awareness with this local Endomarch, as I mentioned, that would coincide with Worldwide Endomarch. So at this session, we are hoping that persons could come out, and it's because the TTA not only tries to raise awareness, but we also try to educate about the disease, as Dr. Jackman would have been saying. So it is more of an education, because we have self-care talks, and from the webinars that we just completed, we understood fully that there is a multidisciplinary approach that is needed to address the issues of endometriosis.
And Dr. Jackman, what would you like to see as a step that should be taken? If you had a list of priorities, we can't get everything we want in the world. We know what it is. If there was something that would give you hope that this is being dealt with far more effectively, what would that be?
I think we need to introduce it at all levels. So we talk of this as a GYN condition. It's a whole body condition. And we need to start teaching this to our general surgeons, to our thoracic surgeons, to our cardiothoracic surgeons. So basically, we need to teach this to all specialties, because this can present anywhere, anybody, and it's usually often passed on as, oh, sorry, this is GYN, we can't deal with it. But really, if you have endometriosis in your chest cavity, you would need the assistance of other surgeons. A gynecologist is not going to be able to operate fully in your thoracic cavity. So we need to really get the word out there that it's a whole body disease, and make all specialties very comfortable with diagnosing and treating this condition. And that would be a really great objective. So less patients are missed, and more people are able to be getting the proper treatment, and much earlier as well.
And before I go back to Mrs. Kingston David to give us a reminder of the actual event again, are you actually seeing, Dr. Jackman, better levels of awareness, more being done to at least acknowledge the existence of endometriosis as a condition, as a prevailing condition with women? Is that environment improving at all in Trinidad and Tobago?
I would definitely say that the Trinidad and Tobago Endometriosis Association has done quite a lot to raise awareness, but there's still more that we need to do to continue raising this awareness, and to ensure that a lot more women are reached, as well as a lot more providers are educated as well. I can tell you personally from my experience, when I was in UE studying medicine, the amount that I know now versus what I knew back then has grown exponentially as expected. But I still myself have a lot to learn about this condition and would like to also educate a lot more people on this so that we can be more comfortable with this condition.
All right, so thank you very much for your contribution, Dr. Jackman. We really appreciate you taking the time to give us some important perspectives on this condition. So, Ms. Hinkson David, it's left up to you just to remind everybody once again of the virtual Endomarch on Saturday at 3 p.m. To 6 p.m. and just remind us again what people have to do if they want to support this particular venture.
Okay, so the TTA invites Trinidad and Tobago to join us on Saturday for a local virtual Endomarch from 3 to 6 p.m. Persons can log on to our website at www.endott.org or visit our Facebook page at Trinidad and Tobago Endometriosis Association to get more information and to register. The event is from 3 to 6 and we're going to have a wonderful time. Yoga, Zumba, dance party. So you can come and join as well.
You see the dance party part, you can leave me out of that if you don't mind. But it sounds like something that hopefully people will support. But indeed, I've just gone on to the EndoTT website and it's fairly straightforward because you get the link coming up immediately to learn more about the walk that's coming up with the $20 for the mask and so on. So it's all pretty straightforward. And I want to thank you very much, Ms. Hinkson David and Dr. Jackman for taking the time to be with us this morning. Yeah, indeed, it is a condition that affects many women in Trinidad and Tobago, but as the doctor correctly said, is often misdiagnosed and leaves many suffering in silence and in tremendous pain for many, many years. And it's something that hopefully the greater levels of awareness will bring about some relief, significant relief for those with the condition. Time for another commercial break, and here we have a pair of what Shana Ramgohan from Princestown says are lovebirds. They're actually budgies or budgerigas, which would be the full name of them, on a rope, and an image captured right here at Express House. We're going to go to now by a member of staff who had nothing better to do on his way to work this morning, or her way to work this morning. I don't want to point fingers, but they captured this butterfly early this morning, probably relaxing, not knowing that he or she is going to be photographed by somebody with nothing better to do. We'll be right back.